Hello and welcome to 6 Minutes. I'm Michael Woodhead. Last week a study in The Lancet showed that metal-on-metal hip replacements had a high early failure rate. So we speak to orthopaedic surgeon Dr. Bill Walter about what advice to give patients.
Well, the metal that they're referring to is cobalt chrome. And the first thing to say is that the cobalt chrome alloy has actually been around for over 100 years in orthopaedics and dentistry. It's a very safe and reliable material that's used in almost all knee replacements and in many hip replacements in the form of metal on polyethylene. The particular concern that you refer to is with a metal on metal hip when there's a cobalt chrome on cobalt chrome bearing. And they've also been used for many years, for 30 or 40 years, with very good results. But there was one particular design that had higher than expected wear, and when there is a high wear, for whatever reason, this can produce a local soft tissue reaction which can be locally destructive. So that was the concern that's raised. There's been speculation that elevated iron levels from these implants may have a systemic effect, but that has not been proven, and that is only in cases with severely elevated levels of the metal ions. The first thing to do is to reassure the patient that it's unlikely that it'll have a problem, because the majority of metal-on-metal hips, particularly resurfacing hips, don't have adverse reactions to the metallic wear debris. But I would advise the GP to send the patient along to their orthopaedic surgeon for review of their hip replacement. All hip replacements should be followed up, at periods of between 1 and 5 years. And in the case of metal-on-metal hips, if they haven't had a recent review, I'd send them back to their orthopaedic surgeon. The orthopaedic surgeon will take an X-ray and examine the hip, and he'll be looking for osteolysis and for any signs of a mass or a swelling. He may also do serum ion levels for cobalt and chromium ions in the bloodstream, and he'll be looking for elevated levels of those ions, and if they are elevated, he would go on most likely to do further imaging such as an MRI scan to look for a local soft tissue reaction. The other part of this question is whether you're talking about a metal-on-metal total hip replacement or a metal-on-metal resurfacing, because it seems to be the metal-on-metal total hips that are more likely to have a problem. The metal-on-metal resurfacing seem to be doing well in the case where a well-designed implant is used, surgical technique is good, and the patient selection has been good. I think the take-home message is that the information available on the internet and in the media exaggerates the problem. I think these implants do need to be monitored by their orthopaedic surgeon. There's no reason for alarm, but there's good reason to continue to monitor all of our implants carefully.